The Birmingham Children's Community Nursing Palliative Care Team is a small team covering a large city with diverse needs and complex health care. Our philosophy is to promote the best quality of life for every child and family we care for. We offer choice and flexibility in families' chosen place of care, including place of death. We're able to facilitate an end-of-life discharge from the acute setting in just a few hours.
My name's Doug Simkis. I'm the Clinical Director in the Children and Families Division, and I'm supporting the nomination of the nursing team for this award. That's an easy task to do because they are a fantastic team providing support to families across the whole of Birmingham in extraordinarily difficult times. There are three main reasons why I support their nomination. The first is they are a service designed with families at the core of what they do. Secondly, it's a 24/7 service. They have fantastic nursing skills, both in communication with children, young people, with families, and in symptom control and tube management. Thirdly, they are excellent in the way they manage boundaries for families, so the families don't have to. They link with primary care, with the acute hospitals in the city, with Acorns Hospice and with social care. This is a tremendous group of nurses that I commend to you for this award.
After our three daughters, we found out we were having our first son. It was amazing. I finally thought my family was going to be complete. And then as soon as he was born, we realised that this is it. He's got a life-limiting disease, and he's not going to survive more than 2 years. It was so hard to come to terms with that. Palliative care came in and explained to us what he had. I'd never heard of EB, and I hadn't realised what was going to happen to him. It was explained to me that he's going to be in a lot of pain and he's going to need a lot of pain relief. He was given morphine and methadone, which I was shocked. I didn't realise children could even be given such strong medication.
We have a 24/7 service and offer telephone advice to all of our families and a visiting service for those children in the end stages of their life.
If he was in pain, he was irritable, he wasn't feeding, all I had to do was pick up the phone, and there was a nurse I knew on the other end and who told me exactly what I needed to do. The nurses pushed us and said, no, look, he's your baby boy, and what you need to do is take him one day at a time and just give him the love that you would give any other child.
The service has a number of non-medical prescribers which we actively prescribe medication, enabling us to lead on symptom control management in the community.
All we had to do was just let a nurse know how much medication we have, and then we'd get our bottle. He'd get his pain relief when he needed it, and that's because the nurses were able to prescribe.
We offer bereavement support following the death of a child, which is led by the individual needs of the family. We support all children and young people to die in their place of choice and will tailor our service to meet their individual needs. All bereaved families are given a memory box from the service and are sent cards on the anniversary of their child's death and birthday.
Because they were there from the beginning up until the very end, I'm so grateful for the support that they gave me all the way through his little life, and after.
Our Children's Community Care Indicator tool enables us to monitor the quality of care we give. We monitor 6 areas. These include the deteriorating child, symptom control charts and advanced care planning. We've achieved 100% harm-free care in all teams during its pilot.
The clinical lead has developed a verification of death policy, which is nurse-led. This is really groundbreaking and will support families at a most difficult and traumatic time.
siblings' needs are always considered holistically. They have their own unique journey, and we support and signpost to various agencies as we feel is required. Our symptom control charts enable us to pick up any changes or deterioration of a child's condition. Parallel planning is essential for our families. Plan for the worst, hope for the best. Our most vulnerable children have a just can't wait box in the home, which contains anticipatory prescriptions and medications that allow us to treat any presenting symptom without delay. We have 2 respite carers in the team that offer a limited amount of respite to some of our families.
She's really helpful. She look after him, and I saw that house works and everything. Even he has an appointment, she still go with me and attend his appointment. We attend his appointment. Their service is excellent.
Yeah, well, to me, respite care is all about looking after the whole family, providing the care that they all need, because it's not just a child who's dying that's actually going through something. They're on a journey, and you've got to help them in that journey.
We share families' journeys and empower them to care for their child in their own home and surroundings. A key worker is responsible for ensuring all practical, emotional, physical and spiritual needs are met.
It was like an angel coming down for us. We haven't forgotten anybody. Everybody who came to our house, everybody on the phone, we knew their names, we knew what they looked like. And more than nurses, they were our friends. And later on, they become more like a family.
The team's focus is very much on quality of life. Strong relationship building enables us to lead on advanced care planning and enables us to empower parents to create happy memories of their child's life.
On Billy's wish list, it was to go to a spa. My mum arranged one in Kidderminster. At this time, she'd got a syringe driver, which needed to be changed every day. And we managed to do that by the girls coming out. It was above their call of duty to come out to us. They didn't have to. It was as though she was the only person that they've got to deal with, even though they've got other children on their books that they had to go out and see. And it was as though they made her their first priority of each day, to make sure that she was comfortable and she was looked after. They moulded themselves around our home life. They didn't just come in and say, right, we're doing this, we're doing that. It was, how can we work things round to suit you? What's better to suit you, especially for Billy and also for myself. They became friends, they became part of the family. They were a godsend and they helped out whatever they could. So I get texts out of the blue every now and again just to remind them, saying they're still thinking of me and thinking of Billy, which is brilliant because it makes me smile to think we were together for so long. It was like a break-up at the end, but you're still there and they're still helping. I could not have done anything without them, and I think Bill's existence towards the end would have been 10 times as worse if they weren't there to help.